Hello, I'm Dr. Suprada, urogynecologist at Akkineni Hospital. I hope you're doing well. Today, we'll cover some key information. Stay with us and note it down.
Between 50 and 90% of women develop stretch marks during pregnancy. It is one of the most common physical realities of carrying a child, yet the biological mechanism behind it is heavily misunderstood. For decades, cosmetic marketing has framed these marks as a symptom of dry, tight skin that can simply be moisturized away with the right lotion. This cross-section of the skin shows what is actually happening. As the abdomen rapidly expands, the mechanical stress exceeds the skin's elastic limit. At roughly 20% elongation, the organized structural grid of collagen and elastin in the deeper dermal layer physically tears, even as the top epidermal layer remains intact. At the exact same time, pregnancy hormones, specifically elevated cortisol, flood your system. That cortisol actively suppresses the fibroblasts in your skin from synthesizing the new collagen needed to repair those tears. Stretch marks represent a form of failed wound healing, resulting in disorganized scar tissue rather than restored skin architecture. The skincare industry tends to sell uniform, one-size-fits-all treatments for these marks, but scientifically, these scars are not static. They undergo a highly distinct structural evolution. This timeline charts the phases of skin evolution. After the mechanical stress of pregnancy, scars enter the striae rubra phase, inflamed dermis packed with swollen blood vessels. Months later, they enter striae alba, leaving a permanent white line of disorganized scar tissue. This creates a major dilemma. Most people buy a stretch mark product without identifying which biological phase their scar is currently in. The success of any clinical intervention depends entirely on matching the tool to the current biological phase. Applying a white scar treatment protocol to a red scar wastes your money and yields zero results. Let's look at the specific actions you can take during pregnancy to stop these tears from happening in the first place. The most common approach is to buy expensive topical creams, cocoa butters, and oils, and apply them diligently to the stomach every day. These products will provide surface hydration and ease the itching of tight skin, but they offer almost zero structural protection against genetic susceptibility and the deep dermal tearing caused by cortisol and extreme physical stretching. The medical alternative for prevention is far less glamorous: strict adherence to clinical weight management guidelines. Looking at this matrix of clinical options, we start with prevention. Gradual, guideline-appropriate weight gain directly reduces the severe mechanical stress concentrated on the abdomen and hips. Keeping that expansion slow and steady minimizes the risk of snapping those elastic fibers. While managing weight velocity requires more discipline than applying a cream, it addresses the primary mechanical trigger of the tear, providing a structural defense that topical hydration lacks. If marks do form, you enter the early postpartum window. The scars are fresh, clearly defined, and brightly colored red or purple. Because this phase is defined by inflammation, the optimal clinical intervention is pulsed dye laser therapy, or PDL. This diagram illustrates the mechanism of PDL. The laser specifically targets the hemoglobin inside those active dermal blood vessels. It shrinks the vessels down, drastically reducing the active redness and stopping the inflammatory process in its tracks. Updating our matrix, the trade-off for PDL is substantial. It requires a high financial investment and typically 6 to 10 clinical visits. However, it yields a massive 50 to 75% visual improvement in the scars. The cheaper, at-home alternative is the consistent application of topical retinoids over 3 to 6 months. Retinoids modestly increase cell turnover to help early scars fade, but they come with a strict medical warning. They cannot be used while pregnant or breastfeeding. This red window is the most responsive healing period your skin will have. Delaying clinical action here means letting the inflammation settle, missing the opportunity to halt the scarring process before it locks in permanently. Once a scar passes the 6 to 12-month mark, the texture changes permanently, and the color fades to a flat silver or white. You have now entered the striae alba phase. At this point, PDL and topical creams become utterly useless. There is no longer any active inflammation or vascularity for a laser or serum to target. To address these mature scars, dermatologists have to switch to fractional lasers, like CO2 or erbium, or utilize deep microneedling. Because the scar tissue has settled, the mechanism of treatment must be aggressive. These tools physically ablate or puncture small, precise columns of skin. By creating a new, controlled injury, they force your body to violently remodel the old, stubborn collagen and lay down flatter, smoother tissue. Adding this final row to our matrix reveals severe trade-offs. To achieve results in this late stage, you have to endure 3 to 5 days of highly visible redness, up to 2 full weeks of peeling skin, and a significant financial cost per session. Treating mature stretch marks requires accepting physical pain and downtime to force the skin to restart a healing process it had already abandoned. Before you spend a single dollar, you need a definitive reality check on expectations. A complete 100% erasure of stretch marks is scientifically uncommon. In the clinical world, a 50 to 70% improvement is considered a major win. To figure out your exact next step, look at this decision tree. If you are currently pregnant and your goal is prevention, stop buying expensive aesthetic creams. Route your efforts into optimal nutrition and gradual, steady weight gain, while accepting that your genetics will still play a heavy hand in the outcome. If you are postpartum with fresh red or purple marks, skip the over-the-counter serums. Urgently consult a dermatologist for PDL therapy while the vascularity is still active and treatable. If your marks are old and white, you must weigh the high cost and physical downtime of fractional lasers against a guaranteed maximum of about 70% improvement. If that trade-off isn't worth it, your most logical choice is purposeful acceptance. Stop treating stretch marks like dry skin. By aligning your investment directly with the biological timeline of your scar, you stop wasting money on cosmetic noise and start making choices that yield real clinical results.